there's no excuse for women to go through this.
You have to get this information out to the general public because it's going to have a huge impact.
It's estrogen that drives a normal cell to become a cancer cell, and it's progesterone that protects against it.
We're suffering and we're dying. And I really believe, and I know in my heart, that we need to do something else.
The hue and cry has to get loud enough.
We're talking about, in 10 years, the difference in 40,000 women being alive.
As a woman gets older, her hormone levels can change greatly, causing all sorts of illness, from headaches to cancer. Hormone health has always been a medical problem, but there may be a new solution. I'm Tia Marlier, and welcome to Alternative Medicine. Today we'll learn about an important natural hormone called progesterone, which may be the only hormone supplement a woman needs as she ages. Acclaimed California physician and author Dr. John Lee has researched progesterone and now educates both the public and medical professionals about hormone balance and health.
It is well known that the only known cause of cancer of the uterus is estrogen dominance. And now it's becoming apparent that 30, 40, 50% of breast cancers that occur are probably due simply to estrogen dominance.
Women today are getting one dose fits all, probably getting way too much. And that estrogen is not balanced by progesterone. Very often it's balanced by progestins, but progestins, or synthetic progestins, have a totally different function in the body than natural progesterone. So what we need to be getting back to is what our bodies were producing all along.
Dr. David Zava is the scientific director with Aeron Laboratories and has conducted extensive research on the effect of estrogens and progesterone on the growth of breast cancer. Dr. David Luce is a graduate of Harvard Medical School and holds a fellowship at Yale University. An internal medicine specialist, he has a deep understanding of the human body and physiology.
It is very strong evidence that what's actually going on here is not a dearth of estrogen, but it's a lack proportionately of progesterone.
After menopause occurs, a woman's body, psyche, and well-being can change dramatically. Let's meet Anne, a woman who has experienced firsthand the change of life brought on by hormonal imbalance.
Menopausal symptoms I experienced were the foggy thinking, anxiety attacks, the fibrocystic breasts, headaches, fatigue, unbelievable fatigue where I'd have to lay down just in the middle of the day for no reason. PMS like you wouldn't believe, mood swings like you wouldn't believe, anxiety, that was the worst one. Having a big cry over doing the dishes one night, just could not figure out what was the problem. It felt hormonal. It was that or a breakdown. It was severe and it was disabling. It was becoming more and more obvious to me that I needed to look at this issue.
The traditional or conventional treatment of menopausal symptoms implies the use of estrogen for symptoms such as hot flashes, night sweats, and vaginal dryness. Many years ago, it was observed that women passing through menopause would complain of these particular symptoms.
As I talked to other women, there's, oh yeah, it's menopause, just go get some estrogen, which didn't feel right to me. In fact, it kind of scared me every time I heard that word. I just felt unnerved. So I felt that wasn't the thing for me to do. But I wasn't enjoying the first hot flashes I had. I ran screaming to my balcony one day, just couldn't believe. I was taking clothes off and wringing wet by the time I got outside and going, God, if this is what women have talked about, I don't really like this very much.
Interesting thing is that after menopause, a woman's body continues to make estrogen. It's made by her body fat. By converting a compound made by the adrenal gland that's soluble in fat, it's turned into estrone, which is a major the primary estrogen hormone in women. And the amount she makes should be enough, but she isn't responding to it because she's also deficient in progesterone. When you add the progesterone, then the estrogen receptors regain their sensitivity, and then her estrogen is sufficient and she no longer has her hot flashes. So in my practice, I did not often need to ever give estrogen. And now with the new information about the dangerous side of estrogen, I'm very happy that I did that.
There are three types of estrogens that are produced in the body. There's estradiol, estrone, and estriol. Estradiol is an important hormone for the female reproductive system. It's important for your brain. It's important for normal reproductive function. But at the same time, it is a hormone, if it's not metabolized properly, can form a carcinogen or a cancer-forming hormone.
The metabolic pathways have been worked out so that we now understand that it's estrogen that drives a normal cell to become a cancer cell, and it's progesterone that protects against it.
During specific phases of a woman's life, when she's producing too much estrogen and not enough progesterone, she's more vulnerable to a carcinogenic insult. She's more vulnerable to developing cancer. The problem today is that ovarian function, the body's ability to produce progesterone, is somewhat compromised because of pollution and stress, and probably also because of other types of drugs that women are taking. So it's just, women I think are producing less progesterone because of that. They're producing a lot of estrogen, and that makes them more susceptible to development of breast cancer.
I did have a friend who had breast cancer last year and was told immediately to go off of the estrogen that she was on because, of course, it can make it worse, apparently. And she showed up at breakfast with this book one morning when we were to meet and said, "I think you should look at this page." And on the page, I felt like I was reading a description of myself for all the symptoms I was going through. And I said, what is this? And the book talked about natural progesterone. I immediately, I think within 48 hours, found it, got the stuff, started using it, and within the first month, more than half of those symptoms went away. The breast swelling, the fibrocystic breasts that were so uncomfortable, within a month was gone. The headaches started to subside. The mood swings, they went away. I'm not an anxious person. I'm not the mood swing type anyway, pretty even. But I found within a month's time, it all started to shift. So I felt that I was on the right track.
The research right now that's coming out of the big clinical trials says that estradiol, or replacement estrogens, are beneficial for the brain in terms of preventing Alzheimer's disease, are beneficial for the bones in preventing osteoporosis and fractures. But the bad side of the estrogen is that it causes cancer. It causes cancer of the uterus, and it causes cancer of the breast. And the longer you take these things, the more chance you have of developing these cancers.
Next, we'll learn how estrogen and progesterone get out of balance after menopause, and about the important difference between synthetic and natural hormone supplements. We'll be right back.
The idea of menopause being a sudden drop of all the estrogen or absence of estrogen is not true.
This was a period of time when women tend to be estrogen dominant. It's a time when they're producing estrogens, but they're not producing progesterone.
A recent report in the family practice journal that I take showed a graph showing the change of hormones as a result of menopause. And the estrone, which is called E1, it's a major estrogen that you make, E1 only drops about 35%. The body continues to make estrone. Isn't that interesting? Even if you removed her ovaries. And yet the typical doctor and the typical woman says, "Oh dear, I'm going through menopause, all my estrogen has left." No, it didn't. It's still there. It's just the body's not responding to it because they're also deficient in progesterone.
It makes sense to me that somebody goes from their estrogen levels are this large premenopausal, they go through menopause and they drop down 15 to 25%. They're not dropping out of sight. What drops out of sight is progesterone, not the estrogen.
And a lot of these women have had problems either mentally or with their energy and have had trouble getting that back. And after getting on therapy or some kind of intervention, they were able to regain their status and their back to their level of energy and the level of accomplishment that they had before.
The body is no longer, after age about 45, capable of producing adequate amounts of progesterone, and that's why I think progesterone supplementation is very important, especially in that age category of about 45 to 50.
If you feel somebody needs one of the hormones that the body should be making, such as estrogen, such as progesterone, the hormone that you replace the missing hormone with should be the same hormone. It should be identical to the body's own hormone. The pharmaceutical companies create compounds that act something like the real hormone, but they're not. They're foreign to the body, they have more side effects, they don't do as well.
The synthetic hormones are not able to go through the same metabolic pathways that the natural hormones are able to go through.
Processing a synthetic hormone is difficult for the body because the synthetic hormone is totally foreign to the body. Processing we call metabolizing. It's a way of altering the molecule so it can be excreted in the bile by the liver, it can be excreted by the kidneys in the urine, and so on. And this process involves very precise chemical steps that cells have been designed to do for millions and millions of years. And if the molecule is not quite the same molecule, it can't be processed the usual way.
In our evolution as a species, our bodies have never seen these hormones before, so they don't know how to handle them. Our liver doesn't know how to handle it. These, the metabolic processes for elimination are not familiar with these hormones, and so they tend to accumulate and build up and have negative feedback effects in the body.
Properly treating hormone imbalance often results from the patient taking an active role in her own diagnosis. When alternative medicine returns, we'll learn about a few things a woman can do to ensure her own health, right after this. Being aware of hormone problems and being proactive in diagnosis can help a woman deal with the effects of menopause. Dr. Lee has a few suggestions.
To find out if you have low hormone levels, you first have to know that such a thing exists, that low progesterone does happen, and the doctor may not recognize estrogen dominance when he sees it, and the patient will have to ask the doctor, perhaps we should check my hormone levels. And this can be done by blood tests, which are serum tests of the hormones, or saliva. Saliva is actually a more accurate, less costly, and more relevant test.
I would advise women to ask their gynecologist for saliva to find out what their hormone levels are. I think that's very important to understand.
It's a simple procedure. Biologically, it makes more sense because the saliva is representative of the bioavailable level of hormone that's in your body.
Saliva has been used by the World Health Organization, and in particular in the research by Dr. Peter Ellison of Harvard, who has been monitoring hormone levels in women around the world.
Next, Don Kells, head of Aeron Laboratories, shows us how easy it is to take a hormone test right at home, and it takes just a few minutes.
Samples are tested or collected first thing in the morning. So when you get up in the morning, before you do anything else, you flush your mouth out with clear water. There's a little piece of gum included with the kit. Chew the gum, and after about a minute or a minute and a half of chewing, you just begin to spit. Nothing fancier than that into the tube itself. And you fill the tube up about halfway, and you cap it, you label, identify your name, the date, and so on. Place it in the mailer and just just drop it in the mail that day or the next day to the laboratory. The sample is stable at room temperature, so there's no special handling required, and results are generally available within 3 to 5 days after the sample's received here in the laboratory.
If test results indicate that progesterone supplementation is needed to balance hormone levels, it's once again a very simple process. Dr. Lee explains.
If you see the progesterone is low and the estrogen is high, then obviously the treatment is to add a little progesterone. I feel strongly, from my experience, that the progesterone, the best route of administration for progesterone is through the skin. I started giving progesterone as a transdermal cream, and it has enough real progesterone in it so that a dab of cream will provide the 15, 20 milligrams a day that the woman should be making. I recommend that people pick the cream by the amount of progesterone that it has. I'm not sure that the other ingredients in the cream have much to do with the absorption of progesterone. If our goal is to get 15 or 20 milligrams a day and to do it for 24, 26 days out of the month, we want a cream that has about 460 or 480 milligrams in a whole ounce. A woman can then take an ounce of that cream and she can, just by practice, just by her own experience, she will find the size of the dab that she needs to apply, and it should be applied on the areas where people blush. In areas where people blush is where there are more capillaries and they're closer to the surface.
I've been using the progesterone cream and I have had no side effects. I don't know what they would be. I feel terrific. I don't believe in the last 10 years I felt this good.
It's not just the act of taking hormones. It's not just the act of doing some kind of intervention. It's the act of maintaining and prolonging a quality of life.
Increasingly porous and brittle bones is another symptom of menopause. Can progesterone reverse the process? We'll find out right after the break. Osteoporosis, a bone disorder often occurring after menopause, responds well to progesterone. This natural hormone can actually help build new bone.
I was taught in medical school that osteoporosis, since it becomes evident after menopause, is due to the absence of the estrogen. Well, we now have bone mineral density tests that we can do early on. It's available to anybody in practice. You can get your bone mineral density tested when you're 35 years old or 38 years old, and you'll find that in that period of time you're already starting osteoporosis. You have plenty of estrogen in your body. You're still having all the periods, but you become a little deficient in the progesterone. So the second hormone, the progesterone hormone, plays a role in osteoporosis. We now know what the role is. Bones are constantly being built, taken apart, and built again. Just like your skin, your hair, all the tissues in your body, they're constantly being made, unmade, and then remade. New cells all the time. In bones, we call it resorption of old bone, because when bone gets too old, it gets more crystalline, more likely to fracture. The old bone is taken out, and then the osteoblast comes in and makes the new bone. So you're constantly making new bone. It's progesterone that stimulates the osteoblast to make the new bone.
In your mid-30s, get a baseline bone density. Why? Because if you are, certainly if you have a family history of osteoporosis, you do that for sure. And then you're saying, you know, I would recommend that to do it anyway. Why? Because if your density is low, you still have a significant window of time to correct the problem.
What I hope is that patients will find doctors who are open-minded, who are interested in learning, who are willing to discuss new concepts and to read the book and to do his own research, rather than just accept the claims that come from the pharmaceutical companies. And if they will do that, then the patient and the doctor together form a team that will work out fine.
If your doctor doesn't get it, won't listen, won't do the saliva test, won't direct you in using this, keep asking. Go to a health food store, ask for a homeopath, ask for references to someone else. I really believe that women have to take it into their own hands. You have to go on a search. It's your body, you got to deal with it. You've got to ask the questions. Knowledge is power, and it means if you got to knock on 10 doors to get there, you do it to save your own life.
I think all doctors learn from their patients, whether they admit it or not. They don't call it practice for nothing. They practice until they get it better.
It's very, very important that we do as much as we possibly can to get the message out of this natural hormone replacement.
The truth is out there, and we need to be looking at that. And we've been told a story. And maybe that story was true for what we knew then, but it's no excuse now. There's no excuse for women to go through this.
We're probably going to see a remarkable reduction in the incidence of breast cancer. We're going to see a remarkable reduction in the incidence of cardiovascular disease. We're going to see a remarkable reduction in many of the diseases that plague Western society. I may be wrong, and I may have to eat the words, but I believe that natural progesterone delivered through the skin is going to be responsible for reducing the incidence of breast cancer by 80%. The baby boomers that are riding this wave that's about ready to crash on the beach, they are going to enormously benefit from natural hormone replacement therapy, enormously benefit from it. But they have to know the best types of hormones to use, the types of hormones that don't cause cancer, that don't cause side effects. We're going back to where we were when we were in the womb.
It's a perfect fit. Mother Nature is very wise, and we're just now understanding Mother Nature.
There are a lot of problems on the basis of hormonal imbalance that we need to look at. And having a second chance in my life is about giving other women a second chance. And hopefully giving our children a chance. Because if we don't do something with this generation in correcting this issue, we are handing it to our children.
New knowledge and a more open-minded approach to hormone balance as it relates to health and well-being is changing the way women deal with menopause. It's an alternative way of treating an age-old problem, and one that is producing incredibly good results. And that brings us to the end of today's edition of Alternative Medicine. I'm T.M. Lear. Join us next time as we explore the world of alternatives that help us stay healthy.